Anna joining us today on the Book Talk segment of the show. Great pleasure to welcome today a man who has put out the newest edition of the Breast Cancer Survival Manual. We're talking with Dr. John Link today, who practices out at the BreastLink Medical Group out in Southern California. He's done some great research on the treatment and of breast cancer over the years. He joined us by telephone. Doctor, thanks for being with us. How are you today?
Good, thank you. Thanks for having me.
Good to have a chance to chat with you for a couple minutes. I had an opportunity to read through the book, and I guess the best way to start off is breast cancer on the rise, stable, or fewer cases, or what's the status right now as far as the number of cases a year?
I think that it's fairly stable. Unfortunately, there's too much of it because one in every 8 or 9 women presently is getting breast cancer, and that amounts to about 260,000 women a year in the country. But with the baby boomers kind of coming through now, there's going to be a blip, I think. So it's a major problem for us in healthcare.
Just some of the notes you had, it's the second leading cause of, unfortunately, death in women. I guess you have it between 35 and 54. Is that unfortunately, the age range where it's most prevalent?
That's the area, that's the range where women, where that mortality rate is. So it affects women beyond age 54 for sure. Mm-hmm. And unfortunately, it affects younger women.
Do we know, Doctor? I mean, obviously, cancer has been studied for maybe over 100 years now or more to try and find not only cures, obviously, but causes of it. Do we know any more today about the causes of particularly breast cancer than we did before?
Well, we know that the cause of the cancer is a derangement that occurs in the DNA in the cell that turns cancerous. And we know a lot about cancer, for example, lung cancer, colon cancer. Unfortunately, the epidemiologists have not helped us that much in breast cancer. And the other thing with breast cancer is that it's a very, what we call heterogeneous disease, and that there are many different types. And so the causes are probably going to be different. We do know that women that are exposed to a lifetime of hormone exposure have a higher incidence of hormone-positive breast cancer. But we really don't have, we haven't made major inroads in discovering cause.
You talk in the book a lot about the cellular structure of cancer and all that. I guess all the stem cell research, that kind of thing, I guess that is a positive step, but still a long way to go as far as that aspect of it being a cure, right?
That's correct. But the whole, ability to look at the DNA of the cancer and sequence it and compare it to a normal cell's DNA really is giving major clues about treatment and new therapies. So that's where the major change has occurred in the last 4 years.
Yeah, let's talk about that since we do have limited time today, and we want to keep it as a positive note, because your book is a positive book. Obviously, if you have breast cancer, it's a difficult thing to go through, but just reading through it has a lot of great information for, I guess, not only what women should ask their doctor, but different kind of treatments that you can go through. Let's talk about some of the treatments and the improvements there. I guess chemotherapy, is that still a prevalent treatment, or is that kind of going away?
Well, hopefully it's going away. We're using less and less of it, and we're using less toxic chemotherapy. One of the reasons we're using less chemotherapy now is we've been able to identify those women that will benefit from it, and we've been able to withhold the traditional toxic chemotherapy from those women that we know have little chance of spread into the bloodstream, or that we've got another type of targeted therapy that's much better. So we're using 30% less chemotherapy than we did 3 or 4 years ago, in spite of the disease being about the same incidence we talked about. and the cure rate has increased fairly dramatically over the last 30 years. It's gone from 55%, and we're very close to 85-90% cure rate now.
Oh, that's good news. Other therapies you talk about in the book, radiation. Now, that used to be a very scary word, maybe still is to people going through it, but I guess it's much more targeted now and much better than it used to be with, I guess, the laser. I don't know if that's the right term, but they can pinpoint it a lot better than they used to, right, where it causes less damage to the good cells, right?
Right. So women that choose lumpectomy, that don't need mastectomies, that have limited surgery, oftentimes will add radiation as an adjunct to that. And you're absolutely correct that that type of radiation we're giving now is much more targeted. There are centers now around the country that are using what we call intraoperative radiation. So at the time where the cancer is removed with a lumpectomy, the woman, while she's asleep on the table, will get the radiation in one dose. So that's a major, major step forward. Not for all women with breast cancer, but for women with no negative localized cancer, it's a very good way to go.
Side effects, that's, again, an unfortunate part of treatment, because there are side effects for any kind of medicine, but particularly when you're going through cancer. But just reading your book, I think that's even getting better now. There's, I guess, certain medication you can take to minimize side effects. Is that right?
Right. So women that do have to receive chemotherapy, with supportive medicines, we don't see women getting nauseated and sick. Many women continue to work right through their treatment. Fatigue is still a problem. But what we want at the end of this treatment journey is that when the acute treatment's done, that women will fully recover and be able to go back and resume their lives with very good quality.
And as you talked about before, the survival rate is obviously always increasing. That's good news, and it keeps getting better and better, so that's a positive thing. I guess the whole thing is, if you have to go through this, try and keep as positive as you possibly can. I know it's difficult, but that's part of the treatment, isn't it?
Yes, I think that's important, and that's what I emphasize in the book, is that, number one, with a diagnosis, which is a huge crisis for most women, there's adequate time to develop a treatment plan and become educated, and that it is not a death sentence, and a vast majority of women will survive.
The name of the book is The Breast Cancer Survival Manual, the completely revised, updated 5th edition. We've been talking with Dr. John Link today. And Doctor, give out a website. Can we get a hold of the book or get a hold of you if they like?
Yeah, so my website is drjohnlink.com. That's the website, and there's also a Facebook page. And the book is available as of today, and one can get an electronic version or a print version through Amazon, or it's available in most bookstores.
Great. Doctor, appreciate your taking a few minutes today. You're doing great work out there, and we look forward to hopefully talking to you again down the road. Thanks for joining us today.
Okay. Thank you, Doug.